Yeah, yours was the first shop I've ever seen a false eyebrow. False eyelashes I've seen plenty, but I've never seen false eyebrows. Where do you get false eyebrows? Are they made specifically for cancer patients, or can you just get those anywhere?
Well, are you talking about the stencils for?
No, I thought I saw some actual little hairy things that look like bugs that you put on above your eyes.
Must have been a bug. No, but we have the universal eyebrow pencil, which matches everybody's skin.
Oh, that's cool.
And some clear gel. But no, we offer the individual eyelashes, and that's for people not going through any treatment, because you don't want to take a chance with the glue around the eyes.
Right.
So we have to just do that for when you get better. We can offer that service. And then we can do a makeover, like when you get your wig, if you want a makeover, we can do the makeup and really show you how to apply it so you can look your best, while you're going through it, because people respond to you differently.
Right.
So if you put on a good appearance, not only do you look better for yourself and your family, you're going to feel better when you look in the mirror. So that really helps, I think.
Jane, you were recently out of town for a work-related conference. Can you tell us what kind of conferences you go to associated with
this? This was actually a school, and I was in Santa Fe, New Mexico for a week, and I am now a certified manual lymphatic drainage therapist.
Wonderful. That's
so
wonderful.
I can do the body work for the complete decongestive. I would ask if you, well, usually your doctor would refer you to a physical therapist for evaluation. And now I'm better able to fit the compression garments. And I can do the body work to follow up. I can't do the bandaging and wrapping, but I can do the follow up or just preventative to keep arms from swelling, and legs, whatever.
For those of you who don't know what Jane is talking about, mastectomy patients sometimes, well, most of the time, have lymph nodes taken out from underneath their arms, which causes a buildup of fluid. Your arm will get enlarged and engorged with fluid. And what she's talking about is compression garments that help keep this fluid from making your arm gigantic. And that's a problem for a lot of people, because
especially traveling. If you're in a plane and your pressure is changing, then you want to wear a sleeve to keep that pressure constant for your trip.
Yeah, like 2 hours before the trip and 2 hours after the trip too. So a lot of people we're finding don't know that.
No, I didn't know it.
So
I mean, I knew that there was therapy for the arm,
right,
but I didn't know that there were actual compression garments.
Mm-hmm.
So that's
and something new that we have now is colorful ones in all different colors, so it can match your outfit.
That's really neat. So do you have to have so many continuing education hours to keep up your license no matter what, or?
Yeah, I do.
Okay.
And as I said, I'm in a certification program for oncology massage. So at the end of that journey, I will be certified to go in the hospital and be a therapist specifically for cancer patients.
I think that's wonderful. I mean, it's hard working with people, I think, that obviously some cancer patients do not survive. And I would imagine that you do get attached to some of your patients.
Well, absolutely, and the goal is to make people feel better whatever stage they're in, either to get them through and on their way to their life as they knew it, or at least their changed life as it is, or to help them into the transition from life to death and make things a little bit more comfortable.
Mm-hmm.
As a surgical nurse, we have some cancer patients who return to us, and you do get, you get attached to them, but we always let those people wear their wigs to the operating room, and we'll put the cap on them and let them come all the way to the OR if they want to, if it makes them more comfortable to do that. So I just think that people don't recognize how important it is to feel like yourself as much as you can for as long as you can.
Well, and I think too, Diane and Jenny, our nail technician, have gone to the hospital to give clipper cuts, or we did send a wig over to a woman who was in palliative care. And I think image recovery, part of that is that a lot of people would like the nail services, the wig and so forth, the makeovers, because they don't want to die looking sick.
Right. And I'm sure they don't want to think of themselves.
Right.
I mean, you know, it's hard to walk by a mirror and see yourself bald,
Right.
or and I just think it's anything you can do to make yourself feel as much like yourself while you're going through this is certainly a plus. And I applaud Centra Health for
Right.
adding this to the Pearson Center. I think it's something that's wonderful. You've already told us what was available in the shop.
And people come in every day and say, this is just so wonderful to have here. You know, the services all in one building, and then to have the salon services, the massage, and all that. They just really appreciate it from all over. So
you do get people from outside who just drop in. It's not just all cancer related.
Well, I would say most of them are cancer related. But what I'm saying is they'll stop in the shop and just say how wonderful it is. And they'll let us know, because not every city has one of these, and this is a regional one. So it's important that we have this here. So I am thankful that they brought it to this area.
Me too.
Another thing I learned in Santa Fe, and there were people in my class from New York, California, New Mexico, Texas, and every one of them, without fail, when we went around to say where we were working and what it was like, they all said, oh, you must work in Wonderland, because none of these places, even in New York, they don't have places like this for their patients.
And it's just a shame.
And we've had a lady visiting her son here. She was from Georgetown, and she just couldn't get over it, that they didn't have anything up around the DC area like that. And you know, she ended up buying lots of different products because she was going through chemo and radiation and really going through dry skin. And so she was very tickled to be taking charge and buying all these things to make her feel better. So, and then she wrote us a wonderful thank you note when she got
That's
back.
great.
So.
I'm hoping that with this program that it will let more people know that you're there and that your services extend to the public if anybody's interested in getting a wig, or you know, that you are there. I'm guessing that you have more female customers than male, although do you have men who are cancer patients who come and take advantage of your services?
A few.
Mm-hmm.
We have a lot of men come in looking for gifts for female patients. So I think as we go along, I think we'll have more male visitors to.
Yes, I've had a couple men for the wigs, and we have wonderful men's hats. And I guess there's not that many hat places around town, so
Not
they
anymore.
enjoy getting their hats in there. And we have some unisex hats too. So I try and have things on hand for the men too. But they're not as interested, it seems like, in the wigs. It doesn't seem to bother them as much as the women. But I try and keep the hats in, and of course, if they want a wig, I'll be happy to help them with that. So I try and make them feel welcome, and of course, they need good skincare products. And I have a regular patient that comes in, and he likes our lavender body wash.
Cool.
You know, it just makes him feel good, and he relaxes with that lavender aromatherapy.
And that's what it's all about.
Mm-hmm.